all this data that people used to studies on, when patients came into the emergency department and had a CT scan for appendicitis, and then all the sort of side diagnoses that were made off that initial scan, and then sort of, how much additional imaging or additional testing was generated off a CT scan for appendicitis, which may or may not have been necessary. But so it does two things. Yes, it can lead you down sort of the wrong path, or lead you down an unnecessary tangent, but at the same time, maybe more importantly, is it may not be providing you the information that you need. I think that's more important. So yes, we have all sorts. Everybody knows the situation of sort of the stress test leading to the cardiac cath, leading to the the retroperitoneal hematoma that caused the patient to get a blood transfusion and blah blah blah. But the more important thing is, while we were wasting our time with this sort of stress test for the heart problem that the patient didn't have, we may have been failing to diagnose sort of gastroesophageal reflux, or some other problem that we just didn't diagnose because we sort of got let off by an inappropriate test. The one thing that I'll say from the beginning is, I think that we're practicing medicine in the year 2012, and a lot of the people who are ordering these tests were in medical school in the 1980s, 90s, and as the complexity of the amount of stuff you can possibly order increases, a lot of times people just aren't aware of the appropriate test to order. And I think so education, or a lack thereof, is a fundamental driver in the ordering of inappropriate tests. I think the other thing is sort of the more popular sort of time crunch, the sort of liability overhang, and that sort of add to this. But I think really, when I think about it, I think it's actually when that physician or whoever that first healthcare person who's approached by the patient is, whenever that sees the patient and they want to answer a question, they might not know the right test to order. And I think that's probably the case in many situations, that no one wants to admit, like, I don't know what's the correct test to order in 2012. I might have known what it was in 2011, and it might not even be the same, but I might not even know what's been the best test for the last 5 years. And so I see it all the time, only because I get physicians who I really respect who call me and ask me, what test should I order to answer this question? And the fact that I don't get it all the time, I think is tantamount.